Hi, welcome back to In a Nutshell. This is your girl P, and today we want to talk about ADHD. What is ADHD, you may ask? According to psychiatrists, ADHD is one of the most common neurodevelopmental disorders of childhood. It is diagnosed in childhood and follows an individual into adulthood. What are the signs and symptoms of ADHD? Children with ADHD have trouble with attention, hyperactivity, lack of restraint and impulsivity, as well as difficulty focusing, short attention span, mood swings, and conduct disorder, and also destructive behaviors. Can adults acquire ADHD, you may ask? The short answer is no. Adults don't suddenly acquire ADHD. In order to meet the diagnostic criteria, several signs and symptoms must be present before the child reaches 12 years old. This means, technically, ADHD does not develop in adulthood. In other words, if you did not have ADHD in childhood, then your current signs and symptoms may be due to conditions such as anxiety, mood disorders, grieving, diabetes, anemia, hyperthyroidism, uncontrolled hypertension, sleep disorders, fatigue, physical overload, and substance abuse. How is ADHD diagnosed, you may ask? ADHD is diagnosed largely through observation rather than other physical diagnostic procedures. However, not doing the assignments or chores of 2 or 3 individuals does not make a person ADHD. Neither does doing strenuous exercises, walking, or kicking a ball. Besides, in order to arrive at an ADHD diagnosis, it would be very dishonest to manipulate a person's surroundings or environment by using gaslighting, hacking, phishing, and social engineering via computer while an individual is writing an article, and by changing or omitting letters or words. We should also be cognizant that gaslighting is forbidden as a means of arriving at an ADHD diagnosis. We must be fair and honest in our research. What is a treatment for ADHD? Again, you might ask, since we have a condition, we need the treatment. Treatment for ADHD is largely supportive. This includes cognitive behavioral therapy, anger management, counseling, exercising, as well as utilizing medication such as dextroamphetamines, Ritalin, Adderall, antidepressant, caffeine, vitamin B complex, magnesium, and fish oils. Now that we know what ADHD is like, we can begin to observe our children for signs and symptoms of the disorder before they're ready for school. So don't wait until they're gone to school and start acting out and you get that call from the teacher. Try and observe them at home before they go out so that you can catch that disorder on time and refer them to your physician. Thanks for listening. This is ADHD in a nutshell.